After 3 years, the new health care laws are about to take effect, and since there are thousands of pages of reform, you may be confused about what you need to do. Tonight, medical reporter Meg Ferris begins a step-by-step look at how to get started.
Some people are in the know, others are not.
Well, Obamacare is the sign-ups are supposed to start October 1st, and then the coverage is supposed to take place January 1st, 2014. I've researched it a little bit.
Do you know anything about the new health care?
No, I ain't hearing about a new health care plan.
So here's what you need to know. From October through March, everyone in the state, with or without health insurance, will be able to explore new plans or options. In this area, 3 companies and organizations have applied to sell or enroll people in one of the new plans. 2 are nonprofit, Blue Cross and Louisiana Health Cooperative, and 1 is a profit group, Humana, but only enrolling in Jefferson Parish. They'll be participating in the federal exchange or marketplace to sell plans to people who do and those who don't qualify for a subsidy. That subsidy will not be cash given to you. The government will give it directly to the insurance companies, helping to lower the cost you owe. Pre-existing medical conditions will not disqualify anyone.
One of the greatest things about Obamacare is the fact that I no longer have to say, I'm sorry, I can't get you health insurance, because that has been one of the hardest things I've had to say over 25 years.
Your rates will now be based on your age, geographic location, and how many people are in your family. And that information will be shared with several government agencies. Some of the insurance experts who've been studying this plan for 2 years say rates could go up.
We think the rates are going to be about 30 to 40% more expensive than what they are today. Because remember, the new plans, Obamacare has to cover maternity from day one. Genetic cancer screening, pediatric dental, pediatric vision.
Rates are more likely to go up for young people who will now have to buy expanded plans. Baby boomer rates could go down.
An older person will never pay more than 3 times what a younger person pays. That means that a 21-year-old will likely get a significant rate increase beginning January 1, and the older people will probably be, their rate will be reduced.
Seniors or the disabled on Medicare don't need to do anything. You will not qualify for a government subsidy in the new marketplace. Now, if you have coverage at work, you can still go on the exchange to see if that plan is better. But if your employer group health plan is affordable, according to the new federal guidelines, you will not get a subsidy. If you're on Medicaid, you can still go on the exchange to see if you qualify to buy health care with a subsidy. But because Louisiana did not expand Medicare coverage, some will still need to rely on the charity hospital system.
Unless you're a pregnant mom or a child, you're not going to get Medicaid. So there's still going to be this hole, this gap of people that won't be insurable or eligible for insurability unless they're getting it through their employer.
People that have an income between 100% to 133% of the federal poverty level, they would not qualify for a subsidy. So they're really out, hanging out for dry, essentially. But the folks that have incomes between 133 to 400% of the federal poverty level, they may qualify for a subsidy on the exchange.
So what that means is the working poor may get some relief on the cost of premiums, but the poorest won't. Now, since Louisiana didn't expand Medicaid, that system is changing as we speak, and beginning in January, many now on Medicaid will have to buy health insurance on the marketplace with the hope that you'll qualify for a government subsidy and cost sharing. Others will still use the charity hospital system. So check on your case with the Medicaid office. We have special links to help everyone and businesses on healthcare reform on a special page on our website. Go to WWLTV.com.